Global Blood Fund is an international, not-for-profit charity that is driven to ensure that patients who need blood will have access to voluntarily donated, safe blood whenever and wherever they need it. In the developed world, we take it for granted that when we need it or where we need it, we'll be able to get a transfusion of safe blood. We are blessed with traditions and cultures and professional collection agencies which ensure that millions and millions of people every year are willing to step up and give the blood that's available to us where and when we need it. Unfortunately, this isn't the case in the developing world.
The consumers of blood in Kenya are mainly women and children. Children in malaria areas, and these are young children who have malaria and due to malaria get anemic, and they probably just need a couple of spoonfuls of blood. And women, of course, when they're giving birth, they lose blood. And if what this means, if they don't get the blood, it's a sudden death for them. And these two groups constitute about 60% of all the blood that is consumed in my country. So it's really, really important that we address the issue of ensuring that mothers and children have blood.
The best solution for these problems is through the cultivation of a voluntary donor base. Global Blood Fund works with local collection agencies in the developing world to give them the resources that they might need to cultivate that population and build that donor base. For example, we give computers so that the donor bases in those countries can be well managed and the names and the rosters can be recruited effectively. Also, we give comfortable donor beds so that the donation experience is good for the donor, and that donor might be in a mindset to come back and give again on another occasion. These are just some of the examples of things we've done. Since 2008, when Global Blood Fund started, we've helped out in Mexico, Haiti, in Asia, and also in Kenya. In these places, we know that we're making a difference in inspiring the donors in those communities to come up and provide that safe, adequate supply, which will really give them the medical support that their communities need for the safest possible futures for their patients.